COVID cases and hospitalizations are surging. Doctors believe that's still due to the Delta variant, though it's expected Illinois will soon see more cases of the Omicron variant as well. Our Amanda Vinicky spoke with a key White House advisor about how the nation is ready to tackle it with an eye toward equity. Amanda joins us now with the rundown.
Yeah, Paris, it became clear early in the pandemic that Black and brown populations were disproportionately impacted by the coronavirus. Dr. Cameron Webb saw that play out through his work in internal medicine in Virginia, and that has informed his role as senior policy advisor to the White House COVID-19 response team.
And I think that the progress, for a lot of groups certainly is there. If you look nationally, the rate of cases, the rate of hospitalizations and deaths, all much improved in communities of color, even relative to white Americans. And so we've seen really strong improvement, and we owe a lot of that to the vaccination effort. And if you look at vaccines specifically among adults, CDC puts out a national immunization survey every week to get a sense of where we are with the vaccination effort. And, the rates of vaccination among adults are pretty much equivalent between Black, white, and Latino adults. And so that's really good news. It tells us that equity, kind of contrary to what some people believed, it's not an aspiration. It's something you can achieve if you center it.
And centering it, he says, means intentional strategy, like recognizing historical and contemporary dynamics of various communities and keeping that as a priority. Also, again, key part of that outreach, the COVID vaccine. Saturday will mark 1 year since the FDA gave emergency use authorization to that first Pfizer COVID-19 vaccine for adult use. But Black and brown individuals are falling behind in Illinois when it comes to getting the booster shot that doctors believe will give extra protection against that Omicron variant. Dr. Webb, when asked about this, said, give it time. That booster effort, he says, is relatively new.
Also, keep in mind the original recommendations for boosters were focused on the over 65 population and other folks who had risk. There are demographic level differences in who's over 65 and where risk lies. And so I think that the CDC's recommendations about a week and a half ago saying that all adults should get boosters, I think that's when you really start that conversation around how can we make sure that all adults are getting those boosters, and we're working overtime to make sure that happens, working with community-based and faith-based organizations, working with partners on the ground and communities all over the country, because the key is making sure that people know why that scientific recommendation was made and know where they can then go to get their boosters.
As of today, the CDC recommending that 16 and 17-year-olds also get that booster shot. The White House's next steps for battling COVID call for rapid response teams to areas where there are rising cases, supplying treatment pills once that is available, and more rapid at-home testing.
Your ability to know if your runny nose or stuffy nose in the middle of wintertime is the typical cold that you tend to have every December, or is COVID, that makes a huge difference for your workplace, for your kids' school, for your community as a whole. So testing, that's certainly a key part of the equation here.
At-home tests, well, you can even get one if they're not sold out, are about $20 each, and that's unaffordable for some, leaving free testing sites that may be inconvenient or have a longer turnaround time as the alternative. Now, the White House planned to distribute millions of at-home tests to community sites, and then also making it so that those with insurance will be able to get reimbursed for buying at-home tests. Critics, though, say that's not enough, noting especially that reimbursement's complicated.
There's no one single way that's going to work for everybody. We know that for a lot of Americans, particularly for folks who've been the hardest hit, for them, it's the ability to get those free tests from their library or get those free tests from a food bank or from a federally qualified health center. So through a different mechanism. When you put these together, you have different strategies to reach different people. And so I think we know that at the end of the day, we want to make sure it's widely available.
And that is on the national front. Taking it back locally, well, Webb, he is in the D.C. area now, but he did spend several years in Chicago when he went to law school at Loyola. Yes, he is both a doctor and a lawyer.
Chicago, there are a lot of amazing leaders. There are a lot of amazing medical centers, and we know they're serving different parts of the community all the time. I think the key is really taking advantage of those resources that you have, connecting it with community. I think I've seen, even in my time in Chicago, some really incredible community-based initiatives, barbershop initiatives, and physicians like Dr. Tom Fisher down at the University of Chicago who are connected in that community-based work. And so there are great folks doing great work at the community level. I think that on the ground kind of effort is going to be a key to the ongoing efforts to address some of the disparities, some of the inequities that we're seeing with regard to COVID.
Now, before I'm done here, a couple of notes on COVID. Saturday will mark 2 weeks until Christmas, and Chicago Public Health Commissioner Dr. Ellison Arwady says that that makes it a really good time if you're to get the shot, whether it's the booster or maybe you want to be fully vaccinated before the holidays, and it's 2 weeks therefore to get that J&J vaccine. So Saturday, really a big deadline. She also says that if you are vaccinated but get what's become to be known as a breakthrough case of COVID, there's still no need to wait to get the booster shot. If you have COVID, you do need to stay at home, that isolation period of at least 10 days. But after that, as soon as you can, she does recommend getting a booster shot. With that, Paris, back to you.
A lot to think about this holiday season. Amanda, thanks very much.